So it looks like this will be part 1 of my journey, and I feel so silly that I'm already so overwhelmed, but I need to allow these emotions because I just got back from the dentist, so I'm allowed to cry, I'm allowed to feel this, and it's understandable that I would be feeling anxious and be feeling fear right now. Getting implants has always been a huge fear of mine because I've had missing teeth for most of my life and my entire adult life, and I will be needing an extraction, and I'll be getting 2 implants on this journey. I actually probably need 2 more on the other side, but we're doing one side at a time, so we're just doing the 2. I think today's April 9th, and February 2nd I got a crown done on the tooth that I'm now getting extracted, so that was for nothing. I never got to use it because of the infection in the tooth that I was told was fine, but another doctor decided that it was time to lose that tooth, so that's what's gonna happen, and I get an implant in place of it. I have the referral for the oral surgeon, and I wanted to document everything because I know dental anxiety is something that a lot of people suffer with, and you don't really get to see it actually happening. I wanted to show my whole process and my emotions throughout, so hopefully it can be something that's a little bit more relatable if you have to go through a similar experience, or if you just have debilitating dental anxiety, that you're not alone, and we can do it. We can get through this, and we're gonna do it. I cry for so many reasons. One, I get very attached to my body parts, you know, including my teeth. I don't like losing them because they're mine. Also the money, I paid for this crown 2 months ago, and I've never been able to use it, and now it's being pulled out, so I paid like $1,500 for nothing, but I think they're gonna work with me on the new crown for the implant and try to help me out there, because obviously this crown is for nothing. So implant ranges around $5,000 a piece, and I'll be getting 2, and then the crown work after will be about $4 grand. So hopefully it's less than $15,000. I could pay off my car with that. I could pay off my student loans with that, but here we are. I'm gonna spend nearly $15,000 on 2 teeth. So I'm gonna document the process of everything, the consult. Well, I don't know if I can film everything, but I'm gonna vlog throughout, at least showing my emotions and the journey, and give you guys a little bit of insight into what it's like to get implants done. And I chose implants because bridges are another option that are maybe $1,000 less, but they drill down the other tooth because they build a bridge between the 2 teeth. So and it's not possible to do on one of my teeth, I think, because it doesn't have another tooth on the other side, so it would be less stable. That's why I chose implants. Implants are lifelong. They will outlive me, so they will still be going strong even when I'm in the ground. That's what I wanted. I wanted something that did not have to be replaced on the line, because I want permanent. I want to use my tooth, and I have not been able to pretty much chew on my left side for 5 years. I'm excited actually to be able to have something work for me on that side. I know it's going to be worth it, and it's just a human problem. It's a first world problem, but it wouldn't even be that bad if I didn't have anxiety. So I've never been put under before, so I have a little bit of health anxiety as well, but unfortunately the infection that I have could also spread to the rest of my body, so it's something that I have to get done as soon as possible. So I'm kind of forced into it. I could just get it extracted and do the implants later, but I'm gonna have to get it done someday, so I am choosing now in 2021 to do it. I have a feeling I'm gonna look back on this and feel a little bit silly, but I think it's important to have empathy towards yourself and understand your emotions, and it's okay. I hope I come back out on the other side so much stronger with 2 amazing teeth that I can chew on, and I can't wait to say that I did it. So we're gonna do it. Okay, today's the day that we call the oral surgeon and make the consultation appointment. It's been a couple days since my little mental breakdown, but I think I'm finally ready. It's Tuesday? What's today? Tuesday. Oh my gosh, I thought it was Wednesday. I originally planned to call yesterday on Monday as soon as possible, but I just really wanted to enjoy my Monday. It was date day and we just, yeah, wanted to hang out. So I don't want to think about it. But now it is time to call. I get nervous talking on the phone, period. So calling about this especially, I'm very nervous, but it has to be done. So let's do it. Hi, my name is Sarah Hawkinson, and I was referred to you to set up a consultation appointment for an extraction and 2 implants.
And is Sarah with an H or without?
With an H, yes.
As long as it's not like a Delta Care plan.
Oh, I think that's what it was, because my dentist doesn't take it either.
Yeah, because Delta Care is like an HMO, right? So then, yeah, that's the one we cannot bill because we are not in the network.
Okay, yeah, that's fine.
Okay.
So they don't take my insurance, which I had a feeling, so.
Okay, because I have the 29th, which is a Thursday. And I have a 1:30, a 2:10, a 2:40, or a 3:10.
Let's do the 1:30 on the 29th.
Okay, Miss Sarah, you have a great day.
Thank you, you too. Bye.
Bye.
Okay, as I was saying, they don't take my insurance, so everything will indeed be out of pocket, which I kind of had a feeling because the dental insurance that I bought was like dental care. I don't know anything about insurance. So it looks like the consultation is actually 2 weeks out, which I'm not mad about. I was kind of thinking the tooth would have to come out sooner than that. So I'm a little bit worried because I do get like shooting pains in my jawbone. So I'm just worried that the infection would like spread, but I think it's just my health anxiety causing me to like be nervous about that because I'm always scared I'm gonna die, you know. So today is April 13th and my consultation is April 29th. So I guess I won't vlog again until then, and I'm not sure if I can like film the actual appointment or anything, but I might get a little bit of vlog footage here and there, and obviously I will share with you after and what the plan will be. Okay, so we're officially a week away from my consultation appointment, and I actually, when I made the appointment, I think it was a different day, it was actually postponed. I got a phone call back from the oral surgeon's receptionist and said that he had family stuff going on that day that we scheduled for my appointment. It would have been, I think this week, this Thursday, it would have been. Today is April 26th. I think it would have been on the 29th. So it's been postponed to May 3rd, which is exactly 1 week from today. I will be doing my consultation officially for my implants. But what I wanted to do now is kind of talk a little bit more about how I've been feeling in the past weeks of hearing the news, because obviously you saw that I broke down about having to do the whole process, and my mindset has completely changed, and I really wanted to also have this video be more inspiring than me just like breaking down mentally and being like, I don't want to do this. So I've had some thoughts. I wrote down some thoughts that I wanted to talk about in this video. So the first one that has been life-changing for me is the concept that suffering comes from resistance. The reason why we suffer instead, I mean, pain is inevitable, suffering is not. Suffering is when you resist something. So instead, and this goes for everything in life, and it's changed my whole mindset with everything in my life. If like I forget something at home, I have to turn around in the car, you know, I've already driven a ways away and I have to go back. Suffering is me not wanting to do that and therefore resisting the fact that that's what I have to do, instead of just saying, well, that's what I have to do, I'm just gonna do it because I have to. I think it's hard on us mentally when we resist something that needs to be done, that's out of our control, and there's nothing we can do about it, so we resist it because we don't want to do it. And that's where suffering comes from, and I just don't want to make my current life miserable in anticipation of misery. I'm not at the consultation appointment. I am not getting the implants right now. I am not paying thousands of dollars right now. I'm gonna enjoy right now because none of that is happening right now. I'm not going to be miserable resisting what is inevitable right now when there's no need. It's completely out of my control. I may be miserable the day of. Who knows? I may hate the whole I mean, obviously I don't want to do it anyway, but I may hate the whole process. It may be horrible. The healing may be horrible. I don't know. But right now, resisting it and feeling negative about it isn't gonna do anything. So what I've really been focusing on is staying present in the moment. I'm not worried about my tooth right now. I'm not worried about my implants. I don't need to worry about that right now because it's not happening right now. I have plenty of time to worry about it later, the day of. Worrying does absolutely nothing but make my current moment miserable. And I don't want to be miserable right now, anticipating how I'll feel later, when that's not even set in stone either. That's not even guaranteed that I'll be miserable then either. So that's really what I've been focusing on, and I wanted to share it because I hope it will help you if you have something that you're resisting as well. That is what causes the suffering, is resisting it when it's out of our control. So obviously I have come around and am doing so much better in accepting the process and what needs to be done. And I will just take it one day at a time, one appointment at a time, and hope for the best. And that's all I can do. All right, today is May 3rd. It's finally time for my consultation appointment for my dental implants. It is currently 12:17 p.m. and my appointment is at 1:10. So we're about an hour out from my consultation, and I do feel anxiety, but it's anxious in a sense of like excitement mixed with nerves. So it's like I'm excited to finally start this process and get it over with, but I'm also obviously anxious about it as well. But I'm feeling okay. Like I definitely was worse when I heard the news. Like that was, you know, obviously traumatic. But I think I just need to embrace the unknown at this point. And today I'm getting a lot of questions answered, obviously. I'll figure out the time frame of the procedure, the cost, as well as the procedure itself and what that's going to look like. I don't know what I'm going to be able to vlog in the actual consultation. I'll try my best, but I don't want to think about that while I'm in there. But if I don't film much of the consultation, I will come back here and tell you all about it. And of course, give you all the information about the procedure and stuff like that as much as I can. So yeah, I guess I will head out in about 45 minutes and go finally figure out what is actually going to be happening. I'm getting lost. I don't know where to go, what entrance to go in.
If you have any questions after watching this video, your doctor will be happy to answer them during your consultation. The only way to accurately evaluate your condition. If you are receiving an implant in the upper jaw, the bone between your mouth and your sinus cavity will be evaluated. If the bone in this area is too thin, it may be necessary to perform a sinus lift during placement. We understand that you may be anxious or nervous about undergoing treatment. It's your doctor's top priority to make you feel safe, comfortable, and well-informed before, during, and after your surgery. A variety of anesthetic options are available to make your procedure more relaxing and pleasant. You may choose to undergo treatment under local anesthesia, which will numb the area being treated. You will remain awake during the procedure and may feel some pressure, but you won't experience any pain in the surgical area. Some patients choose to augment local anesthesia with nitrous oxide sedation. Nitrous oxide is commonly known as laughing gas and is an excellent option if you're nervous about the upcoming treatment or wish to be more relaxed during the procedure.
That'd be through your nerve. This is your nerve right there, that circle right there.
Oh, okay.
So that means we have to go shorter here.
Would it be really weird if I lived without that tooth? I just got one implant.
Maybe. Well, it just kind of stinks because this one chews with almost
That's
nothing. True. So what can happen is this one will slowly move down. It'll kind of, we call it super eruption. It might take years. Some people it happens really fast. So I would say take this one out. What we can do is take this one out, bone graft it. Because I don't think we can do the implant at the same time, but we could bone graft it. And then what we do is see how it heals and if you really miss it or not, and see how it goes and how everything looks.
So still do the bone graft.
Yeah,
even
the bone graft's way better. See how you have all, if I move this out of the way, see how there's dark around it right here? So it's kind of eating away bone around that whole tooth. So when you do the bone graft, it saves this width right here and fills in where all the roots were.
Okay.
When you don't do it.
So that top tooth can still come down even if I wear a retainer?
Retainer would help. You have a retainer that goes over that whole thing?
Uh-huh.
Yeah, what about this wisdom tooth over there? We probably need to take that out at some point too.
I'm actually fine with that. It never bothers me.
Yeah, we'll see. We'll keep an eye on it.
Okay.
You might have to get that one out at some point. We don't have to do it now.
Okay.
But see how it doesn't have a tooth to chew with or anything?
Right.
So it may start irritating you. Does your retainer cover that one?
It does.
That's probably why you're getting lucky so far.
Yeah.
Because this is your jawbone right here. See how it's a little close here? So right here and right here. And if you don't brush it well, you'll get a cavity on it too.
Yeah, I try to take really good care of it because I know it's so far back there.
Yeah, it's so far back, so a lot of people have trouble. So if it gets a cavity, then for sure
Then take it
just take it out because it's not chewing with anything. And you're not going to have anything behind here. And if you did get something behind you, you'd get something right here. You wouldn't even get something that far back.
I see.
But your top teeth are out a little bit over the bottom ones, so we want it. So we'll go like that. So the top of this, we'd like a little bit more bone over it right here. Because really, ideally, the implant kind of needs to be right about there.
I just left and I feel like crying. I think it's because I was so emotional before about the whole process, and I honestly feel a little bit of relief. I'll fill you guys more in when I get home and I'm chilling and yeah, but I feel like it's just a proud moment. Like, I am doing it. I'm gonna face my fears and I'm actually going to get it done. Feels very weird. I never thought I would do this ever. I'm not gonna lie, I did not think that. So I think I'm just so proud that I'm doing it for myself and I'm facing all of my anxieties, and I still, you know, went in at least for the consult despite how scared I was. So I'm gonna go home and collect myself, and then I will update you on everything that I learned in the consultation and how much it's gonna cost and what the process is gonna be. So yeah. All right, so we're back at home. Let's go over everything that I learned. So it went much better, well, about what I expected to happen. Obviously they took some x-rays, 3D x-rays, so it was like the machine that goes all the way around, and then did the consultation and everything like that. I have my appointment scheduled for May 21st, so I will be going in May 21st to finally do it. She told me when I was doing the appointment scheduling, she's like, May 10th, which is a week from today, and I was like, no. She saw my reaction. She's like, oh, okay, maybe not. We can go farther out if you need to. And I was like, yes, please. That's a little bit too soon. So they really understand anxiety, which helps so much for me because that's obviously a big factor in doing something like this. I think anyone, like any average person, would be a little bit nervous to do this. So they're really accustomed to helping people with their anxieties. So I don't want to go too out of order. I did film a little bit in the consultation to try to get some B-roll footage of the explanation. They had me go in and watch a little video, probably like 5 minutes long, of the different anesthesia options, what healing is like, the risks involved with getting implants because we do have a nerve that goes along our jawline. Mine apparently is really high up, so he has to do really short posts, which makes the implant a little bit more unstable, but he's gonna figure that out. That's on him, not for me to figure out. So that's the thing with this consultation. We came up with a plan to extract the one back here. I'm gonna show you my mouth just so you know what I'm talking about, which is very vulnerable for me to do. So hopefully you're not here to judge anyway. So the one all the way in the back on my left side on the bottom needs to be extracted. That's the one that I had a crown done for, that paid money for, never used it. Can't chew on that side at all. The infection is still there, so should I have gone with the earlier appointment? Probably, because it's very uncomfortable, and it's been uncomfortable for years. So I can't tell you how excited I am to get that beast out. Like when he does the extraction, I'm gonna hear it and feel pressure. I don't even care. I'm gonna be celebrating in my head that that tooth is gone. It's caused me so much psychological pain and physical pain and not being able to chew properly. Like, I'm just gonna be so happy that that tooth is gone. And the plan is that I might not even need an implant on that tooth or where that tooth is supposed to be, which leaves me enough money to do this implant on this side, which was not originally part of the plan. The plan was to do the 2 implants on this side, strengthen this side, get that all healed up, and then do this side, which is just the 1. But if I'm not doing the implant in the very back, why not do 2? I was planning on paying for 2 implants anyway, so I'm gonna do the 2 front teeth and implants, and I'm very excited about it actually. So the game plan, get that tooth extracted, put in a bone graft for that tooth, because then that will stabilize the jaw, make it a little bit stronger, even if I don't end up doing an implant in that spot, but it will be prepared if I decide to get an implant down the line. I have to do bone grafting on this hole right here, because the jaw, this tooth has been missing for over 20 years, so the jaw bone is really thin, because there's no tooth there to like make it, there's no need for it to be really thick and stable, so they have to do bone grafting there, which is basically just an artificial bone. So they'll cut open the gum here and implant, well, not implant, we're not doing that yet, put in a little bit of artificial bone to strengthen that side, so when he does put the post in, it's strong and it doesn't move. That's gonna be 1 appointment. So that is what I'm doing May 21st, is the extraction and 2 bone grafts. Then 3 to 4 months after that heals, which is about the healing time for bone grafting if that's necessary, I have to do, then I'll go in for the appointment to do the 2 implants. This side does not need bone grafting. This side, the jaw is still pretty stable, so thank you, so happy. So this one won't even be touched until like 4 months from now when I go in to do this implant post. So he'll drill in, do the 2 posts, and then I think 2 to 4 weeks after that, after that's healed, is when I actually get the teeth put onto the posts, which is done at my general dentist. Because I'm doing oh, that's the other thing. He gave me an option. I could go under, or I could do local anesthesia with some tranquilizers. So guess which one I'm doing? I'm not going under. You don't have to go under for these appointments. Will you hear it? Yes. That might be a little scary, but I'm honestly so used to the sound of grinding teeth for dental procedures and pressure that I'm not even worried about that at all. Plus I could bring headphones. I'm gonna be on some drugs for the day, which we'll get to the prescriptions in a second. Let's talk about cost, about how much all this is gonna cost. For a removal of an erupted tooth, it says, that's gross, $305. I have 2 bone grafts to do, which is $750 each. Fun. So if I did general anesthesia, if I went under, the cost for the 1 appointment would be $2,751. Because I'm just doing local anesthesia for the extraction and 2 bone grafts, it'll be $1,805. And then the following appointment, who knows when that's gonna be, but for the implant body, it's called, is $2,200 per tooth, and I'm doing 2, so that'll be $4,400 for that appointment. And ironically, $4,400 is around what the estimate would be for the actual teeth crowns, the dental crowns that my general dentist will do. So let's calculate how much all of it is going to cost, all said and done. $10,605. You know, I did think that I would be spending closer to $14,000 for this whole thing, so $10,605 is not the end of the world. It is a life-changing amount of money for me, but they take care credit. So I'm gonna do most of it on care credit and pay it off as I go, which is a really convenient option to do. So that's the procedure and the cost and the time frames. Let's talk about these prescriptions. So when you do this procedure, you have to take an antibiotic afterwards. You have to take pain medication, which I'm confused because I should have asked more questions, because we have Norco tablets and ibuprofen. That's 2 pain things. So that makes me a little scared that it's going to be really painful. And then we have an antibiotic, which is amoxicillin. I don't think that's a sulfa antibiotic. I'm allergic to sulfa, so hopefully not. And then we have Halcion. Good old Halcion. Usually my general dentist prescribes me Valium before my appointment. 2 5-milligram pills usually does the trick. He prescribed me 3 Halcions, which Halcions I guess are stronger than Valiums. So I'm gonna take 1 to 2 beforehand and bring the 3rd one. And then if I need it in the moment, they'll allow me to take it before my procedure. So that's the plan. That's how my consultation went. It wasn't as scary as I thought. They were actually really great about it and really nice. Like, they answered all my questions. I didn't feel, you know, weird asking questions, which is really important. So overall, it was a good consult. And the next time I see you will be on the day of my extraction and bone grafts.